Aloha, and welcome to Medicare Answers in Minutes. I'm Martha Clopin, and I'm so excited to take you on this journey today to discuss Medicare enrollment periods. There's a lot of confusion because everyone has a different enrollment period or could have a different enrollment period, but most people don't know about all the different Medicare enrollments that are available. So enrollment periods, exactly what are they? They are specific times throughout the year that you may be able to enroll in Medicare. So let's take the first one, initial enrollment period. When you are first eligible for Medicare, you have a 7-month period to sign up. The 7-month period begins 3 months before you turn 65, the month you turn 65, and lasts 3 months after you turn 65. What are you supposed to do during that time? You should be researching your options at least 90 days before that 65th birthday, contacting Social Security, your employer, gathering information so you know exactly what you need to do and when. Now, some people qualify for Medicare due to a disability. So initial enrollment period is based on qualifying for Medicare due to age, and that magical age right now in 2020 is the age of 65. Now I wanted to just display it a little bit better. So here we have initial enrollment period, again, 3 months before your 65th birthday. So some people think the only time you can sign up for Medicare is during what's called the annual enrollment period. Most people know that that happens through October through December of each year. But when you sign up during your initial enrollment period, it's based on your birthday. So unless you have the same birthday as your best friend, your sibling, your date will vary. So very important to understand this initial enrollment period that's 3 months before your 65th, the month of, and 3 months after. What's so confusing about that period is if you sign up before your birthday, then of course Medicare will start the first day of the month of your birthday. But if you sign up 3 months after your birthday, it could take an additional 3 months before your Medicare insurance will become effective. So you could end up having a gap. So that's why it's so important to understand Medicare and always reach out to Social Security if you're unsure. You don't want to assume because you don't want to end up having to pay a penalty. Now there is another Medicare enrollment period, and this one is called General Enrollment Period. General enrollment period. This is actually for people who missed their initial enrollment period, that 7-month period you have surrounding your birthday. And if you miss it, then you can only sign up between January 1st through March 31st of each year, and your coverage will not begin until July 1st. Some people have paid a very painful lesson because they were unaware that they had to sign up during a specific time. I'm thinking of a story of a gentleman who called an insurance company and he said, I want to sign up for your Medicare plan. So the person who answered the phone said, oh, call us back October 15th. So he thought, oh, okay, I'll call back October 15th. Well, when he called back October 15th, he learned that because his birthday was in January, he actually had this period of time where he could have enrolled in his Medicare and enrolled in a plan, but because he was unaware of it, that October 15th no longer applied to him. He had to wait for the general enrollment period, that's the January till March 31st, and his coverage wasn't going to be effective until July 1st. So he ended up waiting over a year to get his Medicare insurance coverage because he was misinformed because the person didn't understand what he was really looking for. He wasn't just looking to enroll in a plan, he was actually looking to enroll in his Medicare. So very important to understand how these different enrollment periods work, and you can always do that by contacting Social Security at 1-800-772-1213. You may also go to Social Security's website at ssa.gov to learn more. Now again, the general enrollment period is for people who missed their initial enrollment period, and now they still need to sign up for A and B to have coverage. So when a person signs up during that general enrollment period, let's say January is the month that they enroll. Well, when they enroll during January, February, or March, their coverage will actually take place July 1st of that year. So they will not have coverage between April, May, and June from Medicare. I'll repeat that again. If you are one of those folks who missed the initial enrollment period and now you have to wait for the general enrollment period, it begins January 1st of each year and it runs through March 31st of each year. If you enroll during that period, your Medicare Part A and B will become effective July 1st, and you could be without coverage for those months in between. We have another enrollment period. I wanted to just spend time just talking about enrollment periods because many times no one really focuses on these other enrollment periods. The whole focus is on this next one, which is called the annual enrollment period. That period starts from October 1st through December 7th, but I should correct myself. October 1st is when you can preview plans. You cannot actually enroll until October 15th. When you do that, your Medicare plan that you sign up for will become effective January 1st. So your action required is this period of time to enroll is for people who have Medicare Advantage plans. This is not for someone who's turning 65 and is trying to pick up their Medicare for the first time, their Part A and B through the government. This enrollment period is for people who already have a Medicare Advantage plan or a prescription drug plan, and they're looking to see what the new plans will be for the following year, and if there's something that is attractive that will take care of you better than what you have now, this is the period that you can change plans. So very, very important for people to understand all these different enrollment periods because it can become very confusing and you can end up waiting to enroll in original Medicare A and B, waiting for an enrollment period that's for something totally different, which is a Medicare Advantage plan. So just to review, there is also this open enrollment period, also called the annual enrollment or election period. They call it by different things, but again, it runs from October 15th through December 7th. Now, who can make any changes at this time? Let's take a look. So anyone with Medicare Part A and B and wants to switch to what's called a Part C plan. A Part C plan would be a Medicare Advantage plan that has your Part A, your Part B, and also some drug benefits. Those are also known as Medicare Advantage plans. Remember, Part A covers your hospital benefits, Part B covers your doctor visits, labs, x-rays, and Part C is combining all of those programs together. So open enrollment period is for people who have A and B, and maybe now they want to pick up a Medicare Advantage plan to get even more benefits from their Medicare. Also, anyone with a Medicare Part C plan from one insurance company, and they've been looking at other Part C companies, and they decide, gee, I think there's another insurance carrier who would take better care of me. So they can do that as well. Then anyone who is signing up for A and B for the first time, maybe they had a special enrollment period, or they want to drop Part D, they can do that as well. And anyone with one Part C plan can switch to a second Part C plan. So already we've gone through 3 enrollment periods, and wouldn't you know, there's another one. The next open enrollment period, again, the specific time of a year when you can make changes. This one is called the special enrollment period. There's a lot of people who actually, unfortunately, due to the global pandemic, they are losing their employer health coverage. So these folks are 65 years old or older, but they were working and they did not need to pick up insurance because they had coverage through their employer or a spouse's employer. When you lose that coverage, or a spouse, you lose coverage under a spouse, and you're 65 or older, you are required to pick up your Medicare Part A, your Medicare Part B, and you can select a Medicare option to work alongside of your A and B. This period is known as the special enrollment period. For this, to take advantage of this, you will need to complete some paperwork. You have to complete a Part B application, and you also have to have your employer complete a form that proves you were working and had coverage from age 65. So it's very important when you're using the special enrollment period, there are additional requirements that you may need to fulfill in order for you to get Part B. Many times this process can take a month or 2 months or even 3 months. So as soon as you learn you might be losing your employer coverage and you're 65 or older, you definitely want to start the process to take advantage of this special enrollment period. It's also important to learn about this enrollment period because on the form, you actually have to let Social Security know when you would like your Medicare Part B to start. Because some people might be notified of a retirement or a loss of coverage a few months in advance. There's a premium or cost for Part B, so Social Security likes for you to let them know exactly when your Part B will start. Otherwise, they may not be able to process your application. Also, it's very important to understand that because Medicare Part B does cover a premium, the reason you cannot be automatically enrolled is because Medicare doesn't want to charge you for something that you later say that you didn't want. So very, very important to understand how special enrollment periods work, and also make sure you understand there's paperwork that you must complete sometimes. There's also paperwork that your employer must complete sometimes, and both of those forms need to get over to Social Security. Why am I talking about Social Security? It's because that's where the eligibility and enrollment process starts when you're enrolling in Medicare. I had a person call me and wanted to know how they could check on the status of their Part B enrollment. So I gave them the phone number for the Social Security Administration. And the person said, "Why would I call Social Security about Medicare?" And I said, because Social Security takes care of that for Medicare. Once you get your card and you pick up a Medicare option, next you can start talking to Medicare about any issues that you may have. So very, very important to understand, again, different enrollment periods apply to different people. You have to know what category you fit into so you get the right information about your enrollment period. Once again, looking at the special enrollment period, the special enrollment period applies when people have been eligible to delay enrollment into Medicare Parts A. I'll tell you again, A is for hospital, in case you don't remember. Part B takes care of doctor visits, lab work, x-rays, blood draws, fun things like that. Part C is Medicare Advantage plans that cover both your A, your B, and there's another letter there, D, and that's for prescription drugs. So sometimes people can delay enrollment because they're working when they turn 65. They work for a large company, at least 20 or more people, and they actually delay. So once it's time to pick up your Medicare because that delayed period has ended, these special enrollment periods are available to you. These special enrollment periods are also available if you have been living outside of the U.S. and you return. That may give you a special enrollment period to join Medicare Part B. Also, sometimes people have not qualified because they didn't have residency. Then if you meet residency requirements, you may qualify for a special enrollment period. The one that is related to people who delayed due to a job, they have actually 8 months to go ahead and pick up their Part A and their Part B coverage. So Part A, remember that's hospital. Part B, remember that's doctors. They have 8 months to pick up their Part A and B if they're losing employer coverage so they don't have a gap in coverage. But remember Part D, is very interesting about Part D. You do not have 8 months to go ahead and join a Part D plan. For Part D, for prescription drugs, you only have 63 days to join a Part D plan and not have any penalty. So again, most people are not familiar at all with all of these rules and policies related to Medicare, and they certainly can be troublesome if you find out that you missed an important date and you have a penalty. Last story, I promise. I have a gentleman who just recently reached out to me through his spouse, and he is paying an extra $267 every 3 months for his Medicare because he did not sign up when he was supposed to. So I explained what the rules are, and he felt that he was misguided because he was a federal retiree and he did have some coverage available when he retired. However, when he went down to discuss his options, he did say that he wanted to join his wife's retiree plan, and the wife's plan requires Part B. So his wife did not retire at the same time that he did, so he went ahead and somehow only got enrolled in Part A. He did not get enrolled in Part B. And when his wife did retire, he was ready to get his Part B with his wife and join her retiree plan. That was when he got hit with this penalty of over $267. So we are talking to Social Security, or I should say he is. I just gave him a little bit of guidance, but he's asking Social Security if they'll waive that late enrollment penalty because he was unclear that when he was just signed up for A only, that it wasn't coming with the B. He just said he didn't know. He explained and he thought he was getting both A and he was getting Part B and was just unaware. So I don't have the results yet, but it's a possibility that he could be successful because he has very good documentation as to the day he went to talk to someone at Social Security, exactly what he was told and exactly what was completed. So sometimes if you do find that you missed an enrollment period or you have a late enrollment penalty, you can appeal to Social Security to help you with that and see if they will waive that penalty. Because this penalty he pays to over $267 every 3 months, I guess that's coming out to around $1,000 a year. He will pay that penalty for as long as he has Medicare insurance. So very important to understand special enrollment period, general enrollment period, annual enrollment period. What periods are you signing up for your original Medicare? What periods are you signing up for an actual Medicare insurance plan? Those are all very different. That brings us to our last enrollment period. Yep, there's one more. When folks are ready for Medicare, they can also enroll in what's called a Medigap plan. And Medigap plans, often people mix them with Medicare Advantage, but they're totally different. A Medigap program works alongside of your Medicare Part A and B plan. You'll give those cards you'll give your Medicare A and B card to your doctor. If you have a Medigap, you'll give your Medigap card to your doctor's office and they'll process the claims. So the open enrollment period for Medigap is not October 15th to December 7th like it is for Medicare Advantage plans. With Medigap policies, during that first 6 months that you qualify for your Medicare Part B, you're eligible for this open enrollment period to get Medigap. What does that mean? That means you have what's called guaranteed issue and a preferred rate. So even if you have some kind of condition, a chronic condition, a couple different conditions, you get guaranteed issue and a preferred rate. This Medigap plan or Medigap plans work very nicely for people who may have a lot of hospital expenses, a lot of doctor specialists that they see, maybe some drugs that are administered through infusion, because if you have the Medicare and the most comprehensive Medigap program, you could end up paying as little as $0 for most of your benefits. So Medigap open enrollment, totally separate from Medicare Advantage plan. It is the period of time when you're within 6 months of getting your Part B. That could be because you turned 65 or because you lost employer coverage and now you have the first opportunity to pick up a Medicare option. So we talked about a lot of open enrollment periods and enrollment periods today, but I hope that it does give you a little bit of insight into how these programs work. Again, whenever you're looking for more information about Social Security, Medicare, you always want to start with contacting Social Security Administration or Medicare. That's your source because they can put in your Social Security information and verify you. They can look at your record and tell you exactly what applies to you. Remember, when it comes to Medicare, there's no one size fits all. So it's really, really important to talk to the right people so you can get the correct information and avoid penalties and gaps in coverage. I want to thank you again so much for listening to the program. I'm really happy to bring it to you and look forward to seeing you again. Aloha.